Good evening and welcome back to the Canadian Concussion Center's webinar series, which is sponsored by LIUNA, the Laborers International Union of North America. My name is Leslie Rattan. If you've been here before, you'll know that I've been moderating this series, and this is actually, we started in 2021. So we're into our third year of virtual webinar sessions, which was developed for individuals that have suffered concussion, their caregivers, as well as healthcare providers. And if you've been with us before, you'll know that we spend the first half of our webinar hearing from an expert speaker, and then we will open up for question and answer for the second half. If you have missed any of our previous webinars, you can now find all of those. They are posted on the Canadian Concussion Center's website. And for many of them as well, you can actually find the presentation slides if you're interested in those. So for this evening's webinar, just a couple of housekeeping things. If you look to the bottom of your screen, there's a Q&A icon. So if you have any questions tonight, please enter those there. If you're having any technical difficulties, please enter those into the chat and Christian will help you out. He has also put the link in the chat to the previous webinars where you can find them. Right now, we're just going to run a quick poll, and this is helpful for us so that we know who is attending. So I'll just give you a second to do that. And thank you. So for this evening's webinar, I'm really pleased to introduce Dr. Charles Tator, and he's going to be presenting on an introduction to concussions. Dr. Tator is the director of the Canadian Concussion Centre. He trained in neurosurgery and neuropathology and was chair of neurosurgery at the University of Toronto. He was chief of neurosurgery at the Toronto Western Hospital and was also a founder of Think First Canada, a national brain and spinal cord injury prevention foundation, and Parachute Canada, a national injury prevention agency. He held 2 research chairs at the University of Toronto and is also an officer of the Order of Canada and an inductee of the Canadian Medical Hall of Fame and the Canadian Sports Hall of Fame. Currently, he is a scientist in the Krembil Brain Institute and the director of the Canadian Concussion Centre at the Toronto Western. His book on catastrophic injuries in sports and recreation was published by the University of Toronto Press, and his practice primer on concussions appeared in the Canadian Medical Association Journal. He is also the author of 437 publications, probably more than that, now in peer-reviewed journals, and he is a member of the editorial board of the Journal of Neurotrauma and the Neuroscientist, and is an associate editor of the Journal of Concussion. And with that, I'm going to turn it over to Dr. Tator.
Well, thank you, Leslie. Thank you for that lovely introduction. And thank you for continuing on as moderator. And it's lovely to work with you. So tonight is introductory, and this first slide just shows who we are. We're located at the Krembil Brain Institute, part of the University Health Network. And we'll just go on to the next slide. So this webinar series has reached about 10,000 people since we started it, and it's really our privilege to present this to you. So welcome to the first of this series. And the series really consists of about 26 webinars over the course of a year and a bit, every 2 weeks. And we've been able to offer it free. None of our speakers really gets paid, so they're all donating their time. And the series is, as we've mentioned, is sponsored by LIUNA, which stands for the Laborers International Union of North America, Ontario Division, which is really interesting because there are so many workers who do get concussed and have trouble getting back to work. Um, as you've heard, we're having these every other Tuesday at 6 o'clock, and you can look at our website um, to see what other seminars have been held, and you can look at them, and we really encourage you. So the first thing that I wanted to mention is really shown here on this slide, that we are a research center at the Canadian Concussion Center, but we also treat people. So we're very focused on helping people get over the effects of concussion, especially people with lingering symptoms. And you see a lot of names on this slide, and every one of those people plays a role in helping people with concussion get better, and also in doing the research that will lead to better treatment. And the variety of disciplines that are involved, in other words, the type of healthcare professional that is needed for concussion management, is shown here. So you see Dr. Tartaglia is a neurologist, Dr. Nicholas is a radiologist, Robin Buron is a social worker, another social worker, occupational therapist, another neurologist. Leslie is a neuropsychologist. So is Robin Green. Karen Davis is a pain specialist. And then um, people also involved are Dr. Snaderman, who you will see on our webinar series. He gives excellent talks on the mental health aspects. And Shalene Solway is a vestibular therapist who helps people with dizziness. And also, we have to pay tribute to the person who puts this series on the air, Christian Peterson, who has been so helpful over so many years in making this happen. So it's a very multidisciplinary group of people that is necessary to help you get better. And our current series is shown here, the one we've just finished. And in fact, just to see again the number of disciplines that are involved: physiotherapy, radiology, neurology, neuropsychology, psychiatry. All of these are involved in your care. Social work, OT, rehabilitation doctors, exercise physiologists, and even a lawyer, because many people do need help from a lawyer. So the first lesson is that this is a very multidisciplinary issue of concussion, and you need all the help you can get, and we need all the help we can get in helping to make you better. We're very keen to continue to spread these seminars around the world. So even though we're based in Canada, we do have people listening in the USA and in several other countries, and you can help us advertise. So please tell your relatives in other cities and other countries that they can uh, tune in and watch the series live or look at previous ones that are on our website. Nowadays, you can sign up with this QR code. So those of you who are computer savvy can sign up very easily. Um, so tonight is an important event because we're starting off this current series of about 25 sessions, and Dr. Rattan has been with us right since the inception of it, so we're very grateful to her for continuing to shepherd this series along. So please tell everybody involved in your family, your caregivers, your healthcare professionals that you may see. And in fact, this lovely flyer that we use that I show on the screen here was made by a concussion patient for us. So this is just an example that we do want patient input. So if you have suggestions, you can put them the on our chat, or you can put it um, into the Q&A, and we will follow those suggestions. So we do want feedback. So let us know what we're doing right and what we're missing. So this has been quite a long journey for us at the Toronto Western Hospital, because we actually started worrying about concussion in the 1990s. So when you do the math, we've been at this for a long time, and I've personally seen and treated more than 1,000 people with concussion, and so has my colleague, Dr. Carmela Tartaglia, who you will hear from in another webinar. So she's treated an additional 1,000 people. So we've had quite a long experience. And even before we started this concussion center, we were involved in prevention, as Leslie mentioned. So organizations like Think First Canada and now Parachute Canada. And by the way, Parachute Canada has marvelous information on its website. So it's one of the very good websites to get concussion information. And we've been busy publishing, as Leslie mentioned. There are now more than 50 articles that researchers from our center have actually written and put out in medical journals, all available for other people to learn about concussion. So we've been very keen to disseminate our findings. Last spring, we had our 10th annual Concussion Research Symposium, and our 11th is scheduled for April the 26th coming up. We have a chair in concussion, a multi-million-dollar chair. And in fact, we have actually raised about $10 million since we started for concussion research. Concussion research is quite expensive, but fortunately, we've been able to get a number of grants from governments and from private individuals, people who have been concussed, to help fund our activities. We actually run a training program. So we have concussion fellowship, so we can teach other doctors about concussion. And we put on a number of sessions every year for other people, like lawyers and insurers, who will be able to utilize the information that we give them in their day-to-day interactions with concussed people. So this is, very multidisciplinary, and a lot of people are involved. And I would like to just spend a few minutes bringing you sort of an overview of the concussion world. And we use the word awareness or recognition of concussion, and that denotes what we teach in medical schools and what we teach in nursing school and in OT school, etc. That concussion is now an area of healthcare that virtually all clinicians should know something about. And Leslie and I were talking before we went on the air today, and the new figure is that about 1% of Canadians are concussed annually. So that means in our country, of 40 million people, there are about 400,000 new concussions every year. We always said it was the most common brain injury, but the current research just drives home that point that it is very common. Um, and the other thing that we have learned, and I showed you already about the multidisciplinary nature of it. So we need a team of people who are trained and in order to deliver the best care we can. So the next slide shows that other information about why things have changed, and some people call it a concussion revolution, and it is quite revolutionary in terms of the way it used to be. The government of Canada has played a role. In 2017, they decided that we should have a common language and that everybody across the country should know about concussion and speak the same language. And that has actually happened. And I'm pleased to say that they renewed their commitment just a few weeks ago, so that at the end of 2023, they announced that there will be another version of what are called the harmonized guidelines for concussion in our country. Uh, the province of Ontario has been especially good about recognizing concussion as an important condition. And we were the only province to bring in concussion laws. So we actually have now what is called the concussion law, and that was named after Rowan Stringer, who unfortunately died because of unrecognized concussions that she had as a high school rugby player. And so, and the other thing that's happened recently is that there is now a Canadian concussion network. And we at the Toronto Western belong to a network of centers right across the country that work together in concussion. So all of these are good things that have happened in this field. Um, the causes of concussion. Initially, when we started, we used to call ourselves the Canadian Sports Concussion Network. And then we realized that the concussion was a much more prevalent condition, and that there are several important causes of concussion. Sports and recreation are certainly number one in terms of young Canadians. That's how they get most of their concussions. But other people get concussions in a whole variety of ways. For example, motor vehicle crashes. If you're a senior, if you're listening to this and you're a senior, beware of falls. Falls cause a lot of trouble to seniors, and concussion is one of the problems and really can lead to one complication after another. So if you're a senior, beware of falls. Intimate partner violence, unfortunately, is much more prevalent than we thought. In fact, some people have even said about a third of women are subject to this terrible cause of concussion. But at least we know about it now. And then, of course, work is a major uh, cause of concussion. So Canadians have made a difference. In the year 2000, um, I'm talking about this statement by Canadian Association of Sports and Exercise Medicine. They were really early off the mark. And in 2000, they came up with a policy of how sports should conduct itself with respect to recognition and management of concussion. And then when you think of other activities where prevention is extremely important, like seat belts, airbags, extremely important. If you're a senior and you're a little bit uh, unbalanced, and if if things like vertigo are present, you need to use a cane. The emphasis has to be on prevention. If you've had a concussion or two, you'll get over it. But if you've had five or six, your chance of getting over it is much less. So let's not be subject to repetitive falls as a senior. Um, so, Christian, something happened. Oh, there it is. I just poked the wrong one.
It looks okay on my end now.
So, are we okay now? Um,
Seeing the font looks a little bit big, but I can still read everything.
okay, so I'm just going to move forward. And this one we've already done. So we now have agreed upon the definition of concussion, that people are on the same page and everybody using the same definition. We think it's better than the term mild traumatic brain injury. These are almost synonymous. If you have thoughts about that, please write us and let us know. Do you like the term mild traumatic brain injury or MTBI, or do you like the term concussion? I like the term concussion myself because it um, it it is more understood by the public, and calling a brain injury mild sort of is against the grain because yes, it is the least severe of all the brain injuries, but concussion is still a brain injury. We now recognize that women are especially vulnerable to concussion, that certain sports, women concuss more easily. In motor vehicle crashes, we now know that women concuss more easily and it takes longer for women to recover. So the message is try to not get another concussion. So the term MTBI is dying a slow death. There are some specialties that continue to like this term, so they're pretty well synonymous. So we won't really bother you about that, but let us know what you think is a better term. So what else do we want to say about progress? So worldwide, there is a movement to find out more about concussion. And there are several concussion journals, for example. When we first entered this field, none of the journals was devoted to concussion, but now there are several journals in the field that are uh, uh, devoted to concussion. We now know about which treatments work and which don't. And in fact, my colleague Carmela gives a lecture on concussion mythology. So don't waste your time on treatments that are not proven and that don't have the test of evidence behind them. We've mentioned that an army of people working together is often what's required. So the term multidisciplinary needs to be emphasized and also individualized. That concussion is a very individual condition. It's never the same. Even though I've seen 1,000 people who've been concussed, no two of them are alike. So the progress that we've made, I mentioned already that 2023, the Public Health Agency of Canada um, reiterated the importance of concussion and is funding another version of the harmonized guidelines. Ontario government has done its job. Rowan's Law for sports concussion prevention. ONF guidelines are being updated as we speak, even though that organization has been closed, the guidelines live on. And please obtain a copy of our concussion handbook. We give it out in our offices. You can download it from our website, or you can write us for a free copy. So we do have a very good handbook for that. This is our handbook. This is the front page. Here's the table of contents, and you see there's a whole list of things that you can learn about concussion. I mentioned how common it is. Just reiterating, 1% of the population annually, that turns into about 400,000 concussions annually in our country. Other brain injuries, of course, are bruising of the brain or contusion of the brain. So there are a whole number of types of brain injury, but concussion is the most common brain injury. We now recognize that most people, probably about 70% of people, the symptoms do go away in about 30 days if it's been your first concussion. If it's your fifth concussion, you're not going to have it go away in 30 days. But if it's your first concussion, it's usually gone in about 30 days, in about 70%. But that means that there's still about 30% who continue to have symptoms. So that's still a big number when you consider 400,000 people a year in Canada get concussed. And those symptoms can be a huge variety of mental health disorders, depression, anxiety, panic attacks. 35% of people, in fact, who have persisting symptoms do have significant mental health issues. And that's why we do need people like neuropsychologists to assess cognitive decline, people like psychiatrists who can provide advice or medication to those who continue to have PTSD, for example, or post-traumatic stress disorder. And then we also know about a very small number of people, especially as they reach old age, who have had multiple concussions, especially athletes, who can have a rare condition called CTE, or chronic traumatic encephalopathy, but it's very rare to have that. So don't worry about that. The definition of concussion, in the old days, we used to call them bell ringers, dings, seeing stars. These are all concussions. So nowadays, you just use the term concussion or MTBI, and it's the definition is simplified here. We did confuse it quite a bit with whiplash. And in fact, many of you will know that both whiplash and concussion can occur from the same injury, especially motor vehicle crashes. It's very common for people to have both a concussion from jiggling of the brain and a whiplash from flexion, extension, movements of the brain, sort of this movement back and forth of the head on the trunk. So whiplash, we used to call a lot of concussions whiplash, but nowadays we can see what's a whiplash and what's a concussion. And we think that it is jiggle of the brain as the cause of concussion. And, that's a fancy, the fancy term is rotational acceleration or linear acceleration. And it's the jiggle of the brain inside the skull. And that's why helmets, although they do protect against other types of brain injuries, but helmets do not protect against concussion. That's rather unfortunate. So none of the hockey players, none of the other sports that require helmets, they are protecting the brain from the more serious brain injuries like tearing of the brain or bruising of the brain. but they're not affecting the incidence of concussion. There's no helmet that is shown to be concussion proof. So we mentioned about 70% recover. Unconsciousness is rare. We used to think that almost everybody was knocked out in a concussion, and that's not true. Only about 1 in 20 actually loses consciousness. And then, try very hard not to get another one, because we do recognize that as the number of concussions goes up, the length of time it takes to recover and the presence of residual deficits goes up. We have no uh, proven way of grading concussions. So in previous eras, we would talk about a grade 1 or a grade 2 or grade 3. Those grading systems are now thrown out. They don't work. They weren't evidence-based. And so there is no accurate way to grade a concussion. So a concussion is a concussion is a concussion. And it is still a clinical diagnosis. So what do I mean by that? It means that there is no telltale biomarker that tells that you've had a concussion. So there's no imaging, there's no blood test that for sure tells that it's a concussion. We do recognize that the incidence depends on a number of factors, like age is a factor, because as I mentioned, young people get sports concussions, older people get concussion with falls. We recognize that women have a higher incidence in some sports, and now we know for sure that the same is true in motor vehicle crashes. The number of previous concussions is important. There does seem to be a factor that runs in families, that some families seem to concuss more easily than others. We don't know exactly what it is. And then there is this relationship to migraine, ADD, ADHD. People with these conditions seem to concuss more easily. We don't really know why that is. So there's still lots to be learned about concussion. And I mentioned the diagnosis. It's still a doctor or a nurse who makes the diagnosis, because there isn't a biomarker yet. The whole world is busy looking for a biomarker. Is there a blood test? Like nowadays, if you go to the hospital, you think you've had a heart attack, the first thing the doctor does is take a blood sample, because you can diagnose a heart attack very well with a blood test. You can't do that with concussion yet, but maybe next year or the year after, we will have a biomarker test for it, but we don't have it now. We don't have it either as a blood test or imaging test. So you can't diagnose a concussion on a CT scan or an MRI. Now, we do end up doing those tests very frequently. If you go to the emergency and the doctor's not quite sure how bad the blow to your head was, they might do a CAT scan to rule out a more serious illness than a concussion. But you can't see a concussion on a CT scan or an MRI. And in our view, you can't see it on a SPECT scan or computerized EEG, but every few months somebody comes up with you know some little bit of evidence that says, oh yeah, you can diagnose it with a SPECT scan, but it hasn't stood the test of time. So the answer is still no. It's still a clinical diagnosis. So here's a perfectly normal MRI of somebody who's had a concussion, and it looks completely normal. So you cannot diagnose it. So that's the last slide, and I just wanted to pay tribute to our moderator, Dr. Leslie Rattan, who has been doing this work since 2014. We started off by bringing patients to the hospital in the evening with their families. They would have to drive to the hospital, find a parking spot, etc., or take the subway or whatnot, and we would have a session. So look how much better it is now. You can sit in your own home and watch these seminars. And Leslie has been doing this for the last 10 years. So tonight is special. It's her 10th anniversary. Leslie, her daytime job is as a clinical neuropsychologist and clinical psychologist. She has a PhD from York University. She's worked at the Toronto Rehabilitation Institute. She's been in the University Health Network for a long time, and we really owe her a lot for helping develop this series and for sticking with it these past 10 years, shepherding it along, in addition to her own practice in concussion. So thank you, Leslie. We really appreciate your long-term commitment. And I think yes, that is the last slide. And over to you, Leslie, for
Thank you very much,
organizing.
Dr. Taylor. I can't believe it's been 10 years. I was saying it really feels like it was a different world back in the day when we were doing things in person. Okay, so so if anyone watching has any questions, we ask you to put those into the Q&A. And thank you very much, Heather. I think I'll go back to the chat because I know there were some comments around the terminology of concussion versus mild traumatic brain injury, and it's interesting. They often are used interchangeably. Jessica had indicated that she had preferred MTBI. I often refer to TBI, but oftentimes the general public will not understand the abbreviations. Michelle commented that in the MVC or the motor vehicle accident world, the term concussion is often minimized in terms of severity by insurance adjusters, as it is so commonly used, and it may lead the adjuster to make inappropriate denials and deny services, assuming that concussions will simply resolve with time. So that's was from
Leslie,
Michelle.
before I
Yeah.
forget, can I barge in
Yes.
and
Yes.
comment on that, because I think that's a very important point
Mm-hmm.
that is aggravating to many people, that there are some people who tend to minimize the importance of concussion, and that drives me crazy because it's unfair uh, for them to do that. I hear fewer and fewer cases of that. We we've tried very hard to educate insurance company adjusters. In fact, we put on, I didn't mention that, but we put on a number of teaching sessions for other healthcare professionals and for people in other fields. And for example, insurance adjusters, we invite the adjusters to the session that we put on for lawyers. We want lawyers to be as well informed as possible, because if they're going to, talk about you in court and help you with your settlements, they should be as informed as possible. So we run a session with the Law Society of Ontario every 2 years where we educate lawyers, and we invite insurers and adjusters to those meetings. And in fact, we welcome adjusters to come to our annual research symposium at the Toronto Western. The next one is at the end of April. And so we want to educate those people. So thank you for bringing that up. We sympathize with you that if you're having to deal with someone who's uninformed about concussion, it makes it so much more difficult.
Hmm. Wow, we've gotten a lot of comments, and Elias has commented that, yeah, concussion can be confusing um, in terms of people's understanding, and cited an article. So I think the Q&A, the questions are starting to pile up. So I think um, I'll head to those. Um, there are so many clinics claiming to treat concussions. My concern is they are money generating businesses. Do you have any comments on that?
Well, it is, in my view, unfortunate that a lot of the disciplines or healthcare professionals that are important in the management of concussion are not OHIP covered. So when you think of physiotherapists, occupational therapists, vestibular therapists, they're not covered by OHIP. So if you have private insurance, if you have either as part of your employment or if you have WSIB coverage, or if you have automobile insurance that is going to cover you if your concussion is from an automobile crash, for example, they will cover a lot of your expenses for these people. But there is no doubt that there has been a withdrawal of OHIP covered services from when I went into practice. When I went into practice, uh, everybody was covered, like physiotherapists, occupational therapists, neuropsychologists. If we want a neuropsychology assessment done on someone who has a memory problem after concussion, it can cost thousands of dollars. There's no question that there's a problem of access. And if you have any suggestions of how to convince the powers that be that they need to restore funding for therapists who are essential. If you need a psychiatrist, it's covered. If you need a neurologist, it's covered. If you need a physical medicine rehabilitation doctor, it's covered. But other healthcare professionals are not covered. And yes, it has become a lucrative field uh, because people need multidisciplinary care. And concussion clinics have arisen where it's pay as you go. And if you can't pay, you can't go. It is a problem. We recognize it. Yeah.
Great, thank you. We have another question. For how long can a woman who's over 60 with one injury continue to demonstrate progress from persistent, if she's having persistent symptoms?
That is a great question. And we've spent a lot of time trying to find the answer to that question. How long do persisting symptoms last? You can continue to recover for years. So don't give up hope that you can still make gains. You may not make a complete recovery, but there is still a chance for further gains even after years. So follow the regimen that is that you're advised to follow. And if you attend these seminars regularly, you'll see that we now know so much more about how to get better. For example, 20 years ago, people would be put in dark rooms and told, you'll get better if you reduce stimulation. Now it's the opposite. We say, you'll get better faster and more completely if you be physically active. And we want people to start being physically active the next day. So things have really changed. We do recognize that the brain is a chemical factory, that the brain produces chemicals that help the brain recover. And if you don't exercise, the amount of those chemicals that are produced is much below the level needed to restore brain function after a concussion. Exercise makes the brain work faster to make more chemicals to make more recovery. That's the way we now see it. So there has been quite a flip-flop of advice about how to get better from concussion.
Mhm. Great, thank you. Another question, is there any research on whether the use of anesthesia during an unrelated surgery later in a person's life triggers worsening of concussion symptoms in people? So it sounds like if someone has had a concussion and they're continuing to have ongoing symptoms, and then they have to undergo a surgery under anesthetic. I'm not sure if, is there research on that?
Well, that's a great question. And
Mhm.
it is being researched now by the anesthetists or the anesthesiologists. We call them anesthetists. The anesthetists are now aware, much more aware of the effects of anesthetics, especially if you have a very long operation or if you are in the intensive care unit for a long period of time and need extensive sedation because of the noise and because of the machines, and maybe if you need a breathing machine to help you breathe and you end up in the intensive care unit, that can have an effect on your brain. The brain is a very sensitive organ, and anesthetics, especially prolonged use of anesthetics, it is now recognized more and more that can affect brain function. And anesthetists are using less anesthesia than they used to, and they're using safer anesthetics than they previously had. So that field has now recognized this problem. Yep.
Great, thank you. I work with children. What is the best way to prevent concussions in children and to support families of children who are recovering?
Well, our practice at the Toronto Western, for example, does not include youngsters. We have always been available for those who are 11 years old and up. But if you're 10 or 9 or 8, you can't get into our concussion center. So we actually don't have a lot of experience in treating youngsters. We do know from research that the very young, let's say less than 5 or 7, do get more effects of concussion similar to the very old. And we don't really know why that is. But a person in their 80s and 90s will be more affected by a concussion than someone in their 40s and 50s. And we don't know exactly why that is. And similarly, very young kids, we don't know why they're more susceptible to concussion than older kids. Once you reach about 11, your brain is formed sufficiently that you are more like an adult. Probably when you're 18, you're even more like an adult. So there is a gradual progression to an adult brain. So the brain doesn't stop growing. In fact, connections continue to be made in the brain until you're about 25. So the brain, is quite plastic in that nature that new connections can form. And similarly, after trauma, we do recognize that connections that may have become damaged can recover. The brain does have decent recovery potential. So, um, so that's why, multidisciplinary care to try to go at it from many different aspects. We try to treat the headaches, treat the mental health problems, treat the difficulty sleeping, prevent the next concussion, use a cane. Don't be proud if you're a senior. If you're a little unbalanced, use a cane. Very important to prevent the next concussion. You'll get better faster if you don't have another concussion.
Great, thank you. We have a question from someone, and we were chatting before we talked about wait lists and waiting lines in the healthcare system. This question is asking why the concussion clinic, and I think this is perhaps to see probably you, Dr. Tatter and Dr. Tartaglia at UHN, and they had noted that I think when they were a student, I think maybe at U of T, they'd been seen almost immediately. So I don't know if that's something that you can comment on, you know.
Why the waiting list has gotten longer?
Yeah, yeah.
Well, I think it's gotten longer because there are now so many people who recognize themselves and their doctors recognize that they've had a concussion. Whereas before they would say, "Oh, I just had a ding," or "I saw stars," and it wasn't really a concussion. I just saw stars, and okay, I had a few headaches and a little bit of dizziness. That's a concussion. So we never thought there were 400,000 concussions in Canada a year. And so the waiting lists have actually gotten longer. But the good news is that we are training more people in the concussion field. Now, that's both a benefit and a problem because we want them to be, we want them to be recommending evidence-based treatments. We don't want people going out into practice who are not trained. And there are, for example, Quebec has different rules about who can diagnose concussion, who is given the responsibility for diagnosing a concussion in Ontario is different from who is given responsibility in Quebec. That has not been harmonized across the country. And Quebec, for example, a physiotherapist can make the diagnosis of concussion. In Ontario, that's not allowed. In Ontario, it has to be a nurse practitioner or a physician. It can't be a chiropractor. Chiropractor is not supposed to diagnose concussion. Now, a lot of people do get treated by a chiropractor, for example, if they have an associated whiplash injury. And very often, as we mentioned, especially in the old days, there was a lot of confusion about what's whiplash and what's concussion. And as I mentioned, it turns out that many people, especially after motor vehicle crashes, have both a whiplash and a concussion. And although the chiropractor may be perfectly able to manage whiplash, I'm not sure that the chiropractor is the best one to manage concussion. And in fact, in Ontario, they're not allowed to diagnose a concussion.
Okay. Someone's asking if we have a family doctor that doesn't take concussions seriously, how can we educate them?
You can tell them to watch our series. Please do. We would love it if family doctors, if you can get your family doctor to watch some of these webinars, they will learn a lot about the management of concussion. Um, we have, we're so keen to tell people about concussion that um, we're busy thinking of ways of attracting people to this webinar series because we know that the more people we educate, the better it is for those 400,000 Canadians a year who get concussed. So please tell your family doctor to watch this webinar series. We do have a lot of family doctors who come to our events. And as I mentioned, we have an annual concussion symposium, and we have other educational events that doctors can benefit from.
Great, thank you. Just aware of the time, we've got a lot of questions. We'll do a few more. Really interesting question from Dr. Jaffe. Any thoughts on recovery expectation bias related to the term concussion versus mild traumatic brain injury?
Well, you know, I don't like the term mild traumatic brain injury because if you tell someone who's been suffering for 3 or 4 years from a concussion that they just have a mild brain injury, to me, that's insulting. Um, how could something that lasts, let's say, 3 or 4 years be mild? That's not mild. Mild is something that lasts a few days, not a few years. And we know that many patients continue to suffer for a matter of years. So it is a definite brain injury requiring a definite treatment. So that's really why I like the term concussion better. And I think I think more doctors are aware that, especially the term nowadays, when the symptoms persist, we call it persisting concussion symptoms or PCS. And that terminology seems to be uh, acceptable to most doctors. So we're now mostly speaking the same language. So we do understand that symptoms persist. Not everybody gets better in the usual 30 days.
Okay. Heather's asking, do you think that the Ontario laws on concussion will ever go across Canada?
Oh, I love that question.
Yeah.
Thank you, Heather. Um, you know, as I mentioned, I'm so thrilled that we now have concussion laws. I'm not thrilled at the fact that we had to suffer a youngster's death in Ontario before we woke up and passed concussion laws. I was one of the people who sat in the legislature prior to the death of Rowan Stringer and advocated for concussion laws because before Rowan Stringer died in 2013 of her repetitive concussions, um, uh, before that happened, we asked the politicians in Ontario to introduce concussion laws because virtually every state in the USA before the time Rowan Stringer died in 2013, had passed concussion laws. So Canada was slow off the mark, but at least we got on, we got on the playing field in 2018 when we did finally get our concussion laws. But you know what? It's taken 6 years. So let's say 6 years have gone by. Not a single other province in the country has adopted concussion laws. Now, we are having a meeting next September at the Toronto Western Hospital where we've invited, with the help of Parachute Canada, which is Canada's national injury prevention agency, we are holding a seminar on concussion laws. We've invited people from ministries of education, sport, and health to come to Toronto for a day of discussion about concussion laws. So there is a movement to try to convince the other provinces to pass concussion laws. I love the fact that we have concussion laws, that especially for young people. My daughter is an elementary school teacher, and she tells me that every school that she visits has got Rowan's Law posters in the hall telling young people to tell. So that's interesting, the slogan, children must tell. No, actually, the slogan is kids must tell. Which means kids must tell an adult if they have a headache, if they're dizzy, if they feel depressed, if they feel anxiety, if they're having PTSD. If you tell an adult that you're suffering from all of those conditions, you're more likely to get recognized as someone who's had a concussion and be treated for it, rather than be put back into play where you can get another concussion and then die of brain swelling, which is one of the complications of repetitive concussion. Because during the inquest into Rowan's death, it was revealed for the first time that she had had 2 previous concussions the week before she got her fatal injury. So and she had seen many adults during that week, and none of them was told by Rowan. She only told her friends that she had headache, she had dizziness, she couldn't concentrate, etc. And that information only became available at the inquest. So kids must tell, and that's why every province in the country should have Rowan's Law. It also has a great code of conduct that goes along with the law. So if you want to play competitive sports, you have to sign a form that you know what the rules are and that you are responsible for the well-being of not only the players on your own team, but the players on the other team. And you shouldn't take your hockey stick and bang somebody over the head with your hockey stick, because that's against the law. So the code of conduct that goes along with Rowan's Law is, I think, a real deterrent to misbehavior.
Great. Thank you very much. I'm just aware of the time. We have gone over time. I think we could spend another hour or so answering questions. And thank you so much to
I
just
brought my
really
pajamas.
So what I'm going to suggest, thank you so much, Dr. Tator. That was excellent. There will be a survey coming your way. It's very short, and it's great if you're able to provide us with any feedback. But also, if you do have a question that wasn't answered, feel free to put it in there. But just please include your contact info, your email address, because these all come back to us anonymously. So if there is something that you really want answered, please put it in the survey, and we do review those, and then we can do our best to try and get back to you. But thank you so much, everyone, for coming out for our first session of 2024. We are going to be having our next session on Tuesday, January the 23rd. We actually have a new speaker with us, Dr. Andrea Pera, and she's going to be talking about imaging. So anyone with imaging questions can get those answered then. So I think that's it. Thank you so much, and have a good evening.